Is there an alternative that the church proposes for this?
I think, yes, there is, Basil. But I think if you go one step behind, many of us, and I know my aunt who went through the process of IVF, with the lack of knowledge many years ago, went through the process of IVF, had, 2 or 3 cycles of IVF, before which time she realized, this is not what the church advocates, this is not what God is calling me for. But it's important, even if we have healthy babies out of it, even if we have multiple babies born out of it, like I mentioned, the worth of a child is not reduced at all through the process of IVF. But it's important for us as Catholics to repent. It's important for us to repent that we've gone down this line, and then we sort of resolve to not go down this line further. What the church proposes, in fact, is a process which is with far more success rate than IVF, and that is NaPro technology. It is using trying to diagnose what the problem is. So we need to realize, Basil, that infertility is not a disease.
Right.
It is not a disease just to be treated with some medicines, or it is sort of a culmination of a lot of underlying factors that need to be addressed. Sometimes it could be diet,
Yeah.
sometimes it could be our lifestyle. Yes, it could be what we are eating, not eating right. It could sometimes be some anatomical problem, with the uterus, or with the man, and him eating healthy or taking care of his health to improve his sperm quality. And so NaPro technology does 2 things. One is that it sort of tries to diagnose the problem, see if there is any block, any small surgery, are there fibroids, is there a block in the uterus, in the fallopian tube, anything that can be solved. And the second is it uses the help of the cycle, the monthly cycle, and works around that to improve the ovulation, to try to predict or try to determine the time of ovulation, so that the success and the outcome of pregnancy is improved. And in fact, their success rates are pretty high. It's almost in the high 60%, which even IVF cannot boast about.
Yeah. I just have a follow-up question which just came to my mind. What if in the future there is a technology in IVF where there is no need for extra embryos? We could perfect that particular system. Would it still be considered unethical?
I think that process is already there. I think there are still some companies abroad who try to promote, who try to stay on the fence and promote. But again, like we spoke, the process separates the unitive and the procreative act. It separates the unitive and the procreative act. And again, the woman is the man and the woman are just treated as sort of resources to be donors to produce the sperm and ovum. And again, it is done in the sort of a petri dish by a technician, and they have sort of no other role to play in it. And I think we also need to, while we perfect it, we have to realize that success outcomes for just one sperm and one egg uniting are very, very low.
Right.
Very, very low. So there have to be more, sperm and ovum to see the quality and to see that only the best are implanted. So if you have only one, imagine trying every cycle. There's a huge cost factor involved. The huge strain on.
We didn't talk about the cost. How much does it?
Oh, it's lakhs of rupees. The injections are painful. Each injection.
And how long is this process?
I think it's as long as you would want your baby. What if the process fails?
Right.
What if you get
so
multiple?
It could take years.
It could take years, and often it does take years. It's a lot of when a child is born, the mother forgets often the trauma that they went through. But there's a lot of trauma involved. Personally, talking to a few women who have undergone IVF and who have not succeeded. I think we just look at the positive stories, but a lot of women who have not succeeded. It is a very embarrassing, a very humiliating, a very depressing experience for them, and they are often left with feeling of a lot of disappointment, lot of guilt, lot of shame, that sort of they are the ones who could not bear a child, when it's really a sorry state of affairs. So we need to be very sensitive to these issues too.
So, Doctor, you spoke about NaPro technology. How is that different from IVF? Like, okay, you mentioned some of them, but is it completely different?
So, in IVF, the unitive and procreative aspect is separated,
Right.
which is encouraged in NaPro technology.
Okay.
You are encouraged to get a better understanding of your body, of your fertility, take it into your own hands rather than sort of just manage it chemically and give it to a third party. And so, finding out actually what's wrong with you is something that we should all make a part of our life, not just because of pregnancy. And this is what NaPro technology does. It looks at like I said, how we are eating, what we are doing, are we exercising, are we healthy enough, what are we putting into our system, and then it addresses small other issues. It helps a woman become more aware of her fertility, and then through the marital embrace they are able to come together, and the chances of pregnancy increase. Also, the cost factor is nowhere as high
Yeah, that's true.
as IVF. If you're looking at that aspect, is nowhere as high as eating healthy, exercising and taking care of your diet is not
It's
really
almost like free, right?
almost really is free. You can say it's free. The surgeries might cost, if at
Okay.
all, might cost amount, but nowhere as as bad as what the IVF
And I
comes.
think the husband would be more involved in this rather than in
Certainly.
IVF, because in IVF you just have to masturbate. That's the only
Certainly,
thing that you have to
certainly.
do.
You have to masturbate, or maybe you're not involved at all if you get a
Yeah,
donor.
yeah,
Yeah,
yeah.
if you get a
Right,
third party donor and just
right.
not involved at all in it. And so, therefore, it's just very easy to tomorrow back out and say, you know what, I don't want anything of this
Yeah,
in this process.
yeah.